times we don't get to these patients. They're listening to commercials that are telling them that we can cure your gum disease, we can make your gums healthier. You know, the ADA says that they're perfectly healthy for you, and this is what you can use, and you are good to go. Within 2 weeks, you can have healthy gums. So what happens is the patient doesn't go to the dentist, and we're not fully evaluating their potential disease process because they're putting chemicals in their mouth that are masking, potentially, the disease process. So, that's not how this should work. What it should be is that we're in the forefront of the education of our patients, and patients that, people here are not, dental providers, we need to work with our holistic dentists, and for those who are patients, to ask questions about how we can help you, because the main goal is to keep you from having gum disease. The reason being is gum disease is a huge risk factor in oral systemic diseases. It's linked with pancreatic cancer, breast cancer, diabetes, Alzheimer's, etc. I mean, the list goes on and on. So if somebody who has a cardiac problem, they need to go to their dentist to make sure they do not have gum disease, because that is part and parcel can be exacerbating their problems, because about a minimum of 50% of the population have gum disease. It's more like 80%. So we all know that. I'm speaking to the choir, but we all know. Now, this is what's lurking under our patients' gums. For those of us who don't have a phase contrast microscope, I encourage you to find a dentist that has one, or if you're in an office, to get one. Because this is what I love to show my patients. Because when they see that they have these bugs, they're like, yeah, that's why your gums are bleeding, that's why your gums are inflamed. So you can go buy all these fancy mouthwashes and toothpastes and all that mask the problem or put a Band-Aid on the problem, but you're not getting rid of the cause. And that's what holistic dentistry is about getting to the cause of the disease process, not just fixing the symptoms of the disease process. And that would be masking with certain toothpaste, mouthwash, etc. So, enough of that. We're going to talk about the history of toothpaste. I'm not going to bore you too much about that, but back in the Egyptian times, they used to use things like ground oyster shells and salt. Romans used to use urine. I don't know how palatable that would be, but they used to use it for mouthwash also. But yeah, they found it, they thought it was cleansing. So it was very interesting how it started. But that back in the mid-1800s, they started making a toothpaste, but it was in a jar. But in the late 1800s, this Dr. Sheffield, he started putting it in a tube to make it easier to access. So he had a creme dentifrice that he would promote, and then Colgate said, that's a really interesting idea. Let's get on top of that. So Colgate started doing the toothpaste in the tube. Within a couple of years, their I think gross income went from 115,000 to like a couple of million within a matter of 7 years, because they were able to get people on board with the toothpaste. Great thing about having toothpaste is it's easy to clean your teeth, but then that's when we started getting the toxic chemicals put in it. Everybody's looking for solutions. So, what are some of these dangers? If I have to put a label to minimize swallowing or do not swallow on a tube of toothpaste, which is going in your mouth, what's that tell me? There's got to be stuff in there that's not good for you, okay? So, you brush your teeth about maybe 1,000 times a year, and if there's not anything good in it, you're swallowing a little bit. And never mind, because the lining of your cheeks absorb some of that, and for those of us who are dental professionals, the mucosa, you're going to absorb that into your bloodstream. So you want to try to keep it as clean as possible. There are many toxic chemicals, but these are like the 5 kind of ones that kind of pop up a lot. You got of course, your artificial flavorings. You got your artificial dyes, your sodium lauryl sulfate, etc., etc. So more than often than not, you're going to find these things. Yes, I was going to say, anybody who wants to take pictures, please do, because I'm going to have a couple of homemade recipes that if you are interested. But these are some of the components that you don't want in your toothpaste if you're looking in the aisle. I see you're writing them down. Do you want me to wait till you're finished?
That's
You
okay.
good? Okay. So this is just some of them. There's a lot more. Like sodium pyrophosphate, which is one that thankfully I don't use so much anymore. That was tartar control toothpaste, which I, for about a year and a half, back in the day, back in the 80s, could not figure out why my mouth was constantly burning and I had red patches all over my tongue. I went to 3 separate doctors, 3 periodontists, as a hygienist, and nobody could figure it out until I went, and I live in New Jersey, I went to a lecture up in Stowe, Vermont. And they were saying, and here's a picture of an allergic reaction to sodium phosphate. And I went, that's me. I had no, 3 doctors could not figure it out. So that being said, they finally took it off the market. Not because of me, but they just had so many people who had problems with it. So there are plenty of things that can affect people. This is my favorite bad guy. I mean that in a way that I don't like toothpaste with sodium lauryl sulfate. That's the stuff that makes it sudsy, makes it foamy. I often see patients get canker sores, they have allergic reactions, they have a lot of sensitivities to it. Unfortunately, it's considered a skin corrosive. They did lab testing on some rats, and it showed that they got like, diarrhea and other intestinal problems and even caused death. So not that it's necessarily going to cause death in an adult, but we're going to certainly have a neurotoxic effect to it. So you want to avoid anything with SLS in it. You can see here a few more things that can happen to you. So that being said, whoopsie, did you want to go back to that? That's okay. We're in a nice little cozy group, so I don't think anybody would mind. Okay, and of course your artificial colors. FTC number 2 is highly, people become very sensitive, and I think anybody is going to be insensitive to some type of food coloring or dye. I had sensitivity testing, and I was sensitive to yellow 5 and red. I can't remember what number. I mean, it was like a whole litany of lists of how many artificial colors that my body was sensitive to. I don't mean allergic, but my body was reactive to, which means my body would have inflammation. What that means is that if you're using something that your body is sensitive to, you may not have an allergic reaction, like you're not going to swell up or have start sneezing, but your body will have inflammation inside, and that inflammation in your body is a predisposition to other bigger problems in your life. So that's why we do not like artificial colors. Here's the F word. That's what I have to. The fluoride, okay? I am not here to debate one way or the other. In holistic biological dentistry, we are not proponents of fluoride at all, because there are alternatives to fluoride to be able to prevent decay. And if I can use something that is not a neurotoxin, that is not going to cause the IQ of my child to be diminished, it's not going to cause an effect to the patient's kidneys, it's not going to cause my patient, if their small child is getting fluoride vitamins, polybiofluoride, they're drinking fluoridated water, using fluoridated toothpaste, I don't want them to wind up with skeletal fluorosis, which is really bad. Because once you see you have too much fluoride in the water, for those lay people, you have too much fluoride in the water, and gets into the teeth, the teeth become brown, but you don't decay. But if what's in the teeth, that means it's in the bones. So you have a higher incidence of osteoporosis. So if I can think about it this way. Fluoride is meant to what? Strengthen the teeth so you don't get decay, correct? Yeah. What if we can kill the bacteria that's causing decay? Wouldn't that makes more sense. Get rid of the cause, not to keep saying root cause, but it's true. Get rid of the cause of the disease instead of just treating the symptom of the disease. The symptom being tooth decay, which is the #1 preventable disease, especially among children. So if we're just slapping fluoride on teeth, trying to make them stronger, but that bacteria is still there, to me that makes no sense. Kill the bad bugs. And there's ways of doing that. And again, then that would be for a professional course, not today. But you can always come to me later. Back in the 60s, that's when they started introducing fluoride into the tubes of toothpaste. And here's Norman Rockwell. It's beautiful pictures. And here she has her little known cavity sign. But yeah, back in the 60s is when it first was introduced. And here you have your sodium fluoride. And again, if I have to have a big warning on my tube of toothpaste, what is that telling me? Now, even the ADA has even said that with your children, you must put a pea-size amount of toothpaste on the toothbrush if it has fluoride in it. Because they have even realized that too much fluoride is too much. And for those who are interested at where the ADA came from, I'm not here to bash the ADA, but if you're interested, just give you a little tip or hint. Back in the 1800s, mercury came here because the French doctors found it that it worked great for fillings back in the mid-1800s. So it came over here to America, and the American Academy of Dental Surgeons, I think it was, they got together to govern dentistry. And it was the same time where they were doing the hats, men's hats. And these hatters were using mercury on like rabbit pelts, rubbing it to create this felt for their hats. And they found out that these workers were working in an unventilated building, and they were starting to go mad. They had symptoms of mercury toxicity, which we're not going to get into now. So this board said, okay, anybody who is using mercury fillings is a quack. There was a faction of that organization that said, I don't care, I'm still using it because it works. It's cheap. Because right now, at that point, only the aristocrats could get fillings because, gold fillings, the lay people like me, they couldn't get gold fillings, so they would cheaper go out and fall out. So here, amalgams was something that could help these people. So they wanted to continue using it. So there was a faction that broke off. And they wanted to say, I don't care what you say. I don't care if mercury is not safe. We are going to use it. And what did that become? The ADA. So.
It's still the ADA.
What's that?
It hasn't changed a bit.
They're still saying it's absolutely, but actually from what I hear, very recently there's been some hearings that some things are starting to shift. I mean, they did ban it in Europe and for kids and women, so we're hoping. But anyway, we're going to go back to this. I just want to give you a little tidbit of history where the ADA came from. So ADA is going to be a huge proponent of fluoride. It's going to be a huge proponent of mercury because they're going to be the outlier because we're not going to get it. Anyway, there's another one. Triclosan is an antibacterial. You cannot use triclosan. It used to be in your hand soap. You can't put it in the hand soap anymore. But you can put it in your toothpaste, which is going in your mouth, which is going to be absorbed into your body. All right. They said that it's a carcinogen and a neurotoxin, and it's not good for you. It can damage you, but it's okay to be in your toothpaste. So if it says triclosan in your toothpaste, you don't want it. Saccharin, artificial sweetener. I think that's just pretty self-explanatory. Saccharin, aspartame, any of those chemical sweeteners are just not good for you. I can tell you, without even reading a label, if it's got sucralose in it, more sucralose than aspartame, because when I tell you, I get a raging headache and I feel sick. I can tell, because my body just does not like it. So when they're putting these artificial sweeteners and everything, sure, they don't want to put sugar, I get it. But guess what? There's something else you could use, which we're going to talk about in a little bit. So these saccharin side effects, things like cancer, chronic fatigue syndrome, things like that. So it's one of those situations. If you have an option, use the option. You don't want to use saccharin. Carrageenan. This is actually, you say, well, it's got to be healthy because it's from seaweed. but actually it's not. It attacks the gut, and actually can cause a lot of inflammation and irritate the gut, and it's really not the best for you. Try to avoid the carrageenan if possible. And then also the propylene glycol. This is a probable carcinogen, and it's been found in a lot of toothpaste, some mouthwashes. So this is again something that you want to avoid out of the toothpaste. Parabens is another big one. This is actually almost in everything. It's found in, I just gave a lecture on this back in December, on toxicity, and there was a whole list of parabens and so many products that we use. So it's not just toothpaste. So if you see anything with parabens in it, it's a hormone disruptor, reproductive toxicity. There's so many things that can harm you. But a lot of times, if you're a layperson, you look at it, well, they're not going to put anything in here that's going to be bad for me, I'm sure. That's why we have to educate our patients what's good for them and what's not. So, after I'm telling you everything you can't have, so now I'm never going to buy toothpaste ever again. Well, what can I use? And this is where you're going to be able to help your patients help themselves, or you can help provide them things that they can use. For example, bentonite clay is an amazing detoxifier. I remember my mom using bentonite clay for her face. She used to put facial masks on all the time. I'm like, oh, Mom, what do you think? So putting my clay mask on.
Aztec secret.
What's that?
Remember the Aztec secret?
Is that what it was? Aztec secret? Hers was in a tube, and she put it. I'm like, Mom, you putting clay on your face? Like I didn't get it when I was a little kid. Now I get it, totally. So it's a great detoxifier, and it's used a lot. There is a paste called earth paste. I don't know if you've heard of earth paste. If not, it's great toothpaste to use. It is made with redmond clay, which is like bentonite clay. It's basically all kind of ash. So it's a great product to use. Now, for those who want to make their own, or feel very ambitious, here's a recipe for one that is kind of like earth paste. What I like about it is that it's got actually three great, to me, all of them are great. The baking soda is a natural cleanser. Also, it balances the pH of the mouth. pH needs to be either basic or more alkaline, because the more acidic your mouth is you're going to be feeding the bad bacteria. Bad bacteria that cause gum disease like to live in an acidic environment. Baking soda will help that. The bentonite clay is a detoxifier. The xylitol, the dental professionals know what it is. For those who don't, it's made from birch trees. It's a natural sugar, not sugar like you would buy sugar cane, but it has a great property where it'll arrest and potentially reverse cavities. And then the essential oils to taste. Depending on what essential oil you use, things like peppermint is a natural antimicrobial. Tea tree or melaleuca oil, it's great because without getting into, well, actually I have a video later you'll see. Without getting into a big science course, bacteria, it's like an M&M. It has a shell around it, and the tea tree breaks down that shell. So if you put a couple drops of tea tree, a couple drops of peppermint, we'll say, that tea tree will break down that outside layer, and then the peppermint will kill the bacteria, because the peppermint can't get through that shell, so the tea tree will allow that. So that's why it's a nice combination. And those hygienists that are in this room, I'm going to show you a video later, and you're going to spontaneously combust. So you know about it. Xylitol. We were just talking about xylitol. Extremely beneficial. You can buy it on Amazon. You can buy it, my favorite place. You can buy it in Walmart. You can buy it in health food stores, which is preferable, but I'm trying to make it easy for our patients. You want to try to get a fine grain, and if you can't, you just grind it up. It's great for so many things. I use xylitol nasal spray every day in the morning and at night. And it keeps me from getting sick, number one, and also keeps my nasal passages moist. Yes. It helps arrest tooth decay, which we already said, and it can actually remineralize teeth, helps sinus infections. I don't know about the acid reflux. I'm not a doctor, so I don't want to make those claims, but I know how it helps people with problems with their teeth. And actually, with this slide, it gives you a little more information of how the benefits of xylitol. Extremely beneficial. So if we can have somebody use xylitol instead of fluoride, because again, it helps kill the bacteria and it helps strengthen the teeth. Well, what does the fluoride do? It helps strengthen the tooth, maybe. It doesn't kill the bacteria. They say that it does, but I'm sorry. I used to give, in my alter life, I used to give fluoride treatments, and I saw no big difference, honestly. Because if they don't change their habits, if they're still eating garbage, and they're not brushing and flossing properly, you're still going to break down decay. So we need to go the whole gamut. Nutritional counseling, proper home care, give them the tools so that way they don't get decay. So not just putting fluoride on there. So if I'm not going to make my own xylitol toothpaste, Spry is an excellent toothpaste that has xylitol in it. Now, you're going to give this to probably a patient, somebody who has high cavity or high caries risk, somebody who gets a lot of cavities in their mouth. So that's a great company. Also, here's another one that's pretty popular, Epic Xylitol. This is for somebody who has very high cavities rate. There is something that some offices would do. They have prescription fluoride toothpaste. I would recommend this as opposed to using like Prevident or next one, activated charcoal, a whole new rage. Everybody wants to use activated charcoal. I'm a huge fan of using charcoal. People who are, the holistic practices are using charcoal as part of the detoxification process when they're doing mercury removal, depending on what protocol you're using, but that's what it's used. But they found it's like really great in whitening teeth, and it's a great cleanser and detoxifier. So I really like the use of the charcoal. The only thing is, you got to be careful when you're using it or recommending it to patients. They don't have a lot of composite or like white fillings, because sometimes they can stain a little bit, and the patient's like, my teeth getting black. But for the most part, people have natural teeth. They're fine using the charcoal. And what I do like is the fact that this is an abrasive scale. And you can see the active charcoal is only about 90%. Anything under 200 is fine. So the abrasivity of it is really not bad. This is something called the RDA scale that we use to measure how abrasive something is to the enamel in the teeth. So it's less abrasive than some regular, Colgate Optic White is 100, and Arm & Hammer Sensation is 100. So it's not that bad. The reason I have this here is if you have a patient who wants to use charcoal toothpaste, tell them please do not get charcoal capsules from the doctor, from the office, from the store or whatever, and break them open and make toothpaste, because the particulate matter, that is just too abrasive. It's not fine enough. So they're going to actually cause more problems. So please don't use the capsules. This particular charcoal toothpaste, I met them a couple years ago at an IABDM meeting, and I happen to like that. Again, this is just me personally. I happen to like their product. Everything is non-GMO, SLS free, fluoride free, of course, no glycerin. Now, okay, since I said glycerin, some holistic doctors or dentists are like, glycerin's terrible for you because glycerin, it's slippery and it's not good and you shouldn't be using it. And then there's other doctors saying that it's actually not so bad. So it's really good. I'm not going to get into that argument. But the doctor that organized IABDM, he feels that it's okay. So that's your call. But it doesn't have any glycerin. Sorry to go off on it. Oh, he said, oh, look, squirrel. So glycerin. I had to say something. Okay. Now, the oldie but goodie, baking soda. How many of you have parents that use baking soda to brush their teeth? Yeah, of course. And look at the RDA scale is 7. And I know for a period of time, everybody's like, you can't use baking soda because it's too abrasive, it's going to harm the teeth. So if you're scrubbing with baking soda peroxide 3 times a day, yeah, it's going to be a problem. But if you're using just baking soda with a little bit of water, or you mix it with coconut oil, it's really, the abrasivity is not bad at all. And I love the fact that it helps with the pH. Again, like I said, bad bacteria live in an acidic environment. Good bacteria live in an alkaline environment. So you want to keep the pH more alkaline than basic. And that goes to baking soda with peroxide. Back in I don't remember what year, but when I was started practicing back in '84, that's when the Kai's technique was extremely popular. Kai's technique is where they treated gum disease without surgery. They used baking soda and peroxide paste, and they brushed with that to cure their patient's gum disease. They found that long-term use of peroxide in the mouth can actually cause cells to change into undesirable cells, also known as potentially cancerous issues. So, do I like the use of hydrogen peroxide in baking soda? Depends on what's going on in the patient's mouth or what's going on in your mouth. If you use it maybe once a week, that's fine. I do not recommend, I would not tell a patient to do it every day. Absolutely not. Once a week, but again, see your dentist first to get evaluated whether this is something that will be beneficial to you. What's good about the oxygen is, the peroxide, it's got oxygen, that extra molecule of oxygen. It's going to help with the bad bacteria. Bad bacteria love to live in an oxygen-deprived environment. So the more oxygen you put in there, and the higher, the lower the pH, it's not acidic, but the low pH means more acidic. You know what I mean? It's like, raise the air conditioner, which means make it colder. That's what you get when I say. But you want the pH to be alkaline, so the baking soda does that, and the peroxide introduces that oxygen, so you're going to be able to hopefully shift the balance of the good and bad bacteria. This is a homemade toothpaste. I love coconut oil. If I haven't told you, I love coconut oil. It's so wonderful. This is so easy for somebody to make at home. There's no sweetener in here. You can add a little stevia, preferably add xylitol, because you're going to get the benefit of the anti-cavity effect to it. And this is so simple, it's so easy to do. You have another recipe here. I know the font's a little small, I'm sorry. This is a little more time-consuming, but it's got the xylitol in it, and it's got the essential oils in it. These are all very helpful, antibacterial, especially the peppermint and cinnamon. The reason why I love coconut oil is because it's got 2 very helpful acids in it. It's got lauric acid and caprylic acid. Lauric acid kills the bad bug that causes tooth decay. We call it Streptococcus mutans. That's a big fancy word for cavity-causing bugs. And it also has the caprylic acid, which is an antifungal. So what happens is when you're using the coconut oil, you're killing off the bacteria that causes cavities. So if I'm killing off the bacteria that causes cavities, do I need fluoride? No, because I'm not going to get a cavity if the bacteria is out there. Okay? So that's why I like the coconut oil. Baking soda, again, reduces the pH, or raises the pH, I don't know how you want to say it. Xylitol strengthens the teeth. And then antibacterial properties of the peppermint and cinnamon. Prebiotic and probiotics. Everybody's talking about probiotics. Now, probiotics are living bacteria for gut health. But what about, isn't the mouth the beginning of the whole intestine, the whole tract? It starts here and ends someplace else. But it's part of it. So if we're only feeding the bacteria in the gut, we got to start here, really. Because if we're swallowing every day, we're swallowing billions of bacteria. And if there's not enough good bacteria, we're swallowing all that bad bacteria. And you don't care if you're taking probiotics, you're just introducing all the bad bacteria. You're not going to have a is a prebiotic. Dr. Curatola made this toothpaste. He actually is a member of the IABDM. And this is a prebiotic. What it is, it's healthy fiber that helps feed good bacteria. So when you're brushing with a prebiotic, you're feeding the good bacteria and hopefully starving off the bad bacteria. So that's a way to help increase the good bacteria. These are some probiotic toothpastes. They say that are quite effective in introducing the bacteria into the mouth. There are also systemic bacteria that you can take. I'm not going to give a course on what bacteria it is, but there are systemic bacteria that you can take that are specifically for the mouth. They can use them as lozenges or actually as a supplement that you take. Or you can actually even do this, but again, keeping your pH as alkaline as possible. It's critical for your physical health. The more acidic your body is, I don't know if anybody listened to people who were talking about cancer. And for those of you who don't know, I did mention to a couple people, I just finished battling ovarian cancer. I am 3 months out of treatment. That's why I asked my short while. It's just going back. But the more acidic your body is, you have a more propensity or a higher possibility of getting cancer. So that's why it's not just your mouth, it's keeping your body healthy. So unfortunately I just had bad luck of getting ovarian cancer, but we're all good now. So I am watching my pH. I'm making sure we don't have reoccurrence. How can you keep your mouth more alkaline? This is kind of, again, here's another squirrel. Those of you who drink coffee, who loves coffee? Can't live without coffee. It's very acidic, right? Take a tiny little pinch, I don't mean a pinch, I mean a little pinch of baking soda, put it in your coffee, like you're not going to taste the salt, put it in there and it will immediately make your coffee basic or alkaline. And you won't have that acidic. Because again, you get red wines and all these acidic foods and drinks, so, but anything we can do to try to minimize it is going to be to your benefit. So that's just one little tip I give my patients. They're like, oh, that's great. I apologize for consumers, but for those who are in the dental field, do you check your pH of your patient's mouth? Okay. We're going to do that. We're going to start doing that. Very easy. Chairside, you take a little pH paper, there's specific papers, and you just check the patient's pH. See how they're doing. This way you can help guide them into what they need to use. Okay, your pH is really low. You're like 6. 5.8, you need that, I need to raise your pH to be more alkaline so we can not get tooth decay and you don't have gum disease. So that way we can decide what one is good for them. So, how do we change the pH other than using baking soda? We can use aloe vera. There are aloe vera toothpaste, there's aloe vera gel and juice. People can, we have patients sometimes using aloe vera juice and gel. People have a lot of periodontal or gum disease. The aloe vera juice and gel will systemically change their pH and help aid in the healing of their gum tissue. There's actually an aloe vera toothpaste, which is quite nice. Again, just changing the pH of the mouth. Change the pH, you're going to change the balance of the bacteria. This is a mouth rinse. I know this doctor that made this. I actually went to school with his hygienist, Carl. I adore him. He's one of the first male hygienists from a long, it was back in 1984 when we graduated. So, that being said, he's a holistic dentist in New York. He made this mouth rinse. This is great to balance the patient's pH. Because again, patient selection and how you, I'm not going to be using aloe vera toothpaste, and I'm not going to do all these fancy things, but I'll rinse with that mouthwash, Because, some people just don't want to be bothered with a lot of stuff, so this will make it simple. Now, if all else fails, dry brushing. I don't know if you've ever heard of dry brushing. Dry brushing, okay. What you do is when you are going to brush your teeth, you don't have to wet it, no toothpaste. You start on the inside And for us dental professionals on the linguals, or the tongue side, you start on the tongue side. If you're right-handed, start on the right side. If you're left-handed, start on the left hand, on the inside, and you start just brushing everything, and you just start brushing around the mouth until your mouth feels nice and clean, and then you can add toothpaste and then go back in there again. What's that do? Two things. You're reducing the amount of bacteria, and then you're also giving, you're making the patient brush longer. So it really helps because the length of time they're brushing, they've done studies and this shows that if somebody's brushing like this for about 6 months, they reduce the amount of inflammation and bleeding about up to 55% just by showing them how to properly brush at the gum line, making sure you're hitting your gums when you're brushing with a dry brush. I never, ever, ever thought in my career I would ever say that floss was deadly. If anything, I would say if you don't floss, it can affect you because bacteria causes potentially heart problems and increased risk of stroke and diabetes and all those things. So I would never think I would say it's deadly. But recently, studies came out and showed that, and it was all over the news, that dental floss was linked to toxic chemicals. And that women, especially that were using glide floss, had a higher incidence of this particular chemical in their system called a PFHA, I believe, which is don't ask me to say the name, because if I can't pronounce it, it shouldn't be in your body. I can't pronounce it, and I am going to try. So, what's that?
Teflon.
Exactly. So when you're using these particular materials, it's like vortex material. And what happens is it is now leaching into the body and can increase your risk of getting cancer. It's the same material that's found in non-stick cookware. So you shouldn't be using that either. Also, the plastic is not, not eco-friendly, but it's more of the PFASs. I'm trying to remember my acronyms. Teflon, it's a hormone inhibitor. It can potentially cause autoimmune issues, potentially problems with cancer. Again, these are all the non-stick stuff. Your Teflon pans. I'm sure a lot of people have heard that you shouldn't be using non-stick cookware. It's the same reason why you shouldn't be using the Teflon floss. But they make it because patients have difficulty, or people have difficulty flossing, and it makes it easier for them. So guess what? You need to find other alternatives for them. Other than flossing, which I never thought I'd say that, but maybe we need to use a water pick, an oral irrigator. And then, of course, you have your nylon or polyester. This is made from petroleum. Anything petroleum is certainly not good. We want to try to avoid that. But actually, if you had to have your patient use something, or somebody wants to use anything, I would recommend the nylon floss over the glide floss or the Teflon floss. You don't want to use the vortex floss. So it's not great, but it's going to be better than nothing. There are wax flosses that come with a coconut or a beeswax floss, because some of these wax flosses, it's all, again, common chemicals. So you want to look for a floss that is going to have something more natural. This is one that I really like, and this is one that we use in our office, Dr. Tung's. It's covered with beeswax, I think vegetable and beeswax. So it's a nice floss that's not going to harm the patient. Halitosis. Back when they found, we're going to say Listerine, but it was a chemical that they found, oh geez, it's going to help reduce bad breath, so how can we market this? So the marketing company found an old Latin word that was kind of similar for bad breath, and they started marketing halitosis, and that's how Listerine became really, really super popular, because Listerine actually was a solution that was used to clean floors and treat gonorrhea. Truth. And they're now using it for mouthwash. So it's about 40% alcohol, and I don't know about you, I've had people who say, I like Listerine because it burns when I'm using it. Well, if it burns, that means it's hurting you. I mean, No, but it feels good. I'm like, oh, no, that's not good. So, and again, that's why educating your patient on why they shouldn't be using that and why you need to be using these other things, because it's going to reduce your chance of having to sit in my doctor's chair or my chair. Right? The Listerine is not going to do that. You're going to have more problems. These are some of the chemicals in the mouthwashes that we see every day. I'm not going to bore you with reading each one, but they are hormone disruptors, potential cancer promoters, thyroid issues. Alcohol dries out the tissue, and when you have dry mouth, dry tissue, you have bigger problems. So there's just a whole plethora. The chlorhexidine, which is this one here, the heart. The chlorhexidine, actually, for the consumers, that was a surgical scrub. Hospitals used it to scrub their hands, to keep their hands clean before they did surgery. And then a dentist said, well, if it's killing bugs off my hands, it might kill bugs in the mouth. Let's try it. So he diluted soap and used it in patients' mouths. And that's how, and he said, oh, it worked. So that's how the prescription mouthwash was made. And we now know that the chlorhexidine mouthwash, it inhibits healing, especially for we'll talk about later. I don't want to, for the dental professionals, it actually prevents the tissue from, prevents fibrin clots. So anyway, that being said, it's a fibrin inhibitor. So you're not going to get your gum healthy and tight on the tooth. So it's not going to be helpful. So what do I like? Tooth and Gums has been around for a while. Very beneficial. It's a lot of essential oils. It has CoQ10, which is good for heart health. It's also good for the toning of the gum tissue. It's got essential oils that are antibacterial. Other things like rosemary, black walnut, chamomile, or tomato. Soothing, toning, and healing of the gum tissue. So there's a toothpaste and a mouthwash. Also has xylitol in it. Why do we not? Okay, there we go. Some of my patients that have a lot of gum problems, the gums are really swollen and bleeding a lot. This is another one I like, PerioClear with the Perio paste. This works nicely in reduction of inflammation and bleeding. It's also great for a dry mouth. This is basically the exact same thing as I just showed you, but it's easier to find. It's the Perio Bright. Again, I think it has the same proprietary essential oils in there. We have a company that's fabulous, Oral Wellness. They have a line of products that are extremely beneficial to your patients, and patients themselves. If you want to get something, they are retail based, and they're trying to see how we can work with biological dentists so that we can reach more people, because they want to help more people get healthy. Their line has a nice little pack of tooth powder, etc. What happened was one of the owners had a gum issue themselves, and was told they needed serious surgery, needed serious dental work, and they're like, I really don't know if I want to do that. I want to find an alternative to be able to heal myself, because our body innately has healing properties, and we just need to feed those healing properties. So it's not always about slice and dice. Okay, I'm going to stop there. Here's another squirrel. I have a scar on my neck. I'm a hot mess. I have a scar on my neck because I had 2 parathyroid adenomas removed. Why? Because I had broken my ankle. What the hell does a broken ankle have to do with that? I fell downstairs, broke my ankle. 2 months later, I was in screaming agony. They wanted to put pins and screws. They wanted to do surgery on my ankle because they said it was not healing. And I'm like, no, there's got to be another way. There's got to be a reason why my ankle's not healing. So I went to my naturopath. I said, look, this is the issue. I want to know what's going on. He said, let's check your calcium. Calcium was high. Let's check your parathyroid hormone. Sure, that was high. Without going through a whole course, my parathyroid hormone was pulling the calcium that was trying to lay down on my ankle. Once we removed the adenomas, ankle healed. no surgery. So my point in saying that is, the owner is like, I don't want surgery. I'm going to find a solution how I can help my body heal itself. And that's how they came up with this line, which is extremely beneficial. And actually, if anybody is interested in finding out more, Will is right here. I'm going to point you out. I love this story because it really, they want to help more people like they help themselves. Not to say they don't go to the dentist, absolutely. They still get checked, they still got to get monitored, but if we can prevent, and that's the whole idea about biological holistic dentistry, minimally invasive. We don't want to start fixing things that if we can do it in such a way where we're allowing the body to heal itself. So that's a great resource right there for those who are interested and maybe even trying to get that in practice to really help more people. Because that's why we do what we do. Yeah, you should talk to them. Yeah, because, and she was able, she had no surgery. I'm sorry, I didn't need to say she, no. They wound up not having to have the procedure, and the doctor's like, wow, everything's going great. So, it's good stuff. Here's another mouthwash. Instead of that fancy word I used before, chlorhexidine, this is the natural alternative to it, and actually works better than the chlorhexidine. It does not, one thing about this prescription mouthwash that causes staining on the teeth and causes a lot of tartar buildup, this does not. And you're going to get just as good, if not a better result with it. It's great. Now, the thing is, if you're allergic to nuts, almonds, you can't use it because it's got almond oil in it. But it's great, great, great alternative. So you can see there's so many great alternatives. So when you look in that toothpaste file, you don't have to be overwhelmed. There's so many simple alternatives that's right at your fingertips. Mouthwash, another one. Here's a prescription or a home recipe for a mouthwash at home. And actually, on a full disclosure, I took this from Dr. Stephen Lin. For those who don't know who Dr. Lin is, he wrote the book, The Dental Diet. He's big in nutrition and preventing dental disease. So again, he's not about drilling, filling, and billing. It's about keeping people from having to need his work. So this is a nice little recipe. It's another one for homemade mouthwash because you don't want to use things like Listerine and Scope. There's another one for years, Scope. Everybody was using Scope. It does nothing but just mask bad breath. You're not killing the bacteria that's causing the bad breath. You're just putting a Band-Aid on it. Here's another one, spicy ginger. This one's a little more labor intensive for those who are really motivated. I personally myself am not. Full disclosure, sorry. But turmeric, very great for inflammation. Peppermint, antibacterial. Again, cinnamon, antibacterial, anti-inflammatory. Ginger, same thing, anti-inflammatory. This is how you do it. So you have to simmer it for half an hour, and then but it works really nice. It really works nice. So if you're free on a Sunday and you want to make this for your week, it's great. I'd rather do that than buy the over-the-counter stuff that's just not going to help you. It's going to make the situation worse, give you dry mouth and burn your tissue. This is an easy peasy one. This is the one I tell my patients to do. And here you go. You got your tea tree, your Melaleuca, that helps break down the outer layer of the bacteria. And then peppermint oil can kill that bacteria. Baking soda reduces the pH. Everybody got the picture? Oil pulling. We talked about coconut oil before. I am a huge proponent of oil pulling. I have seen the difference in my patient's mouth when they do it. There's different oils you can use, whether it be coconut, sesame, sunflower, etc. Again, I go by studies that I've read. I personally like coconut oil. You can use sesame, also has the same properties, but coconut oil I like because it kills the strep mutans and the fungi, the lauric acid and the caprylic acid. So how do you oil pull? Are we interested in how to oil pull? I was going to do it for you, but I'm like, that's not going to be too pretty. So I've done that. I'll show you.
Hey guys, Dr. Axe here. Today I'm going to show you how to do oil pulling. And this is something that's not just a hot, trendy thing right now. This has been done and had major benefits for thousands of years. It's used today in India and Asia all the time for your oral health. And you may be wondering, well, what exactly is oil pulling? Oil pulling is taking oil, it's typically sesame oil, olive oil, or coconut oil, and swishing it back and forth between your teeth. And the health benefits are it can actually help heal and cure tooth decay. It's been shown to help heal bleeding gums. It's been shown to naturally whiten your teeth, strengthen your jaw muscles, and overall cleanse your mouth and even support weight loss, some people claim. And the truth is this. I was talking to a really well-known dentist recently, and he was telling me that, and this is true from all the medical research, that the health of your mouth, the bacteria in your mouth, correlates with the health of the rest of your body. So by healing your mouth and improving your oral health, you can actually improve the health of your entire body. In fact, periodontal disease or gingivitis or bad bacteria built up within your mouth is an indicator that you are at higher risk of heart disease. And so again, very, very important that you're cleansing not just your body, but your oral cavity in your mouth on a regular basis. This is also a great thing to do to naturally freshen up your breath and give you a glowing smile. So here's how you're going to do oil pulling. You're basically going to take 2 teaspoons of, I like coconut oil. Now, I like coconut oil over other oils because it has antifungal and antimicrobial properties, so it will kill off any of that bad bacteria that's in your mouth and also support the growth of good bacteria. So you're going to do 2 teaspoons in your mouth. You're going to swish it in between your teeth, and don't overdo it. You'll make your mouth sore. Lightly swish it in between your teeth for about 10 to 20 minutes. Now, I'm not going to do that here in this video. I'm going to do it for about 10 to 20 seconds, but typically you want to do it 10 to 20 minutes. And here, that may seem like a long time, but if you do it while you're in the shower, that's a great time to do it, so that'll be 5 minutes alone, and even if you can do just that 5 minutes, it is still greatly beneficial. So do it while you're in the shower, do it while you're reading at night, you can do it while you're just kind of getting ready in the morning. But doing oil pulling, as I said, doesn't have to be complicated, so about 10 to 20 minutes afterwards, you're going to spit out the oil in a cup or in the trash can, and then after that, you're going to rinse your mouth out with water, and then finally, you're going to brush your teeth as normal. And so I'm going to kind of demonstrate here how this would work. And again, you're going to first take here, I'm going to get a big loaded tablespoon or a teaspoon here of coconut oil, and I'm going to put it in my mouth, kind of chew on it for a minute, and then swish it. I'm going to do this for about 20 seconds, so I guess I'll have to be quiet here. You can see me chewing here. It'll melt within about 15 seconds. Now I'm going to start to swish. Do that for 10 to 20 minutes, spit it out, and then the next thing you're going to do is get some water and swish this in between your teeth. Finally, you'll brush your teeth as normal, and I guarantee, do this even if it's just 5 minutes, ideally 10 to 20, but your mouth will feel so clean. You're killing bad bacteria. You're whitening your teeth. You're getting fresher breath. One other thing you can do in your oil pulling if you want to get additional benefits is add, along with the coconut oil, 5 drops of essential oils. You can do essential oil of frankincense, which actually helps support immunity. You can do lavender, which helps your gums. You can also do something like tea tree oil or a blend like that has cloves in it or cinnamon, which actually can help kill off bad bacteria as well. So doing a little essential oils with the coconut is something else you can do together. But just simply coconut oil, I recommend doing this 2 weeks straight every day, and then after that, twice a week. Hey, if you do that, you're going to bring your dental and oral health to the next level.
And I've seen that happen too. The tip that he was giving about adding a little bit of essential oil to your coconut oil, what you can do is if you go to like I guess your dollar store kind of store, you can get like an ice tray that has like the little ice holes. You can make a batch of the coconut oil, like you make it, let it get soft a little bit, add a couple essential oil drops, mix it, and then put it in each thing, and then put it in the freezer. So that way in the morning, I don't have time to do it. You just pop one of those, and then you chew it, hop in your shower, and that way you can do your oil pulling while you're in your shower, you dry your hair, and then you spit it out in the trash, not in the commode, because you're gonna clog up the commode, and then your significant other's gonna be screaming, they got to call the plumber. Throw it, spit it in the trash, okay? Oral irrigators, I can't say enough how much I love oral irrigators. Back in the day, we used to recommend them all the time, and then for about a good 20 years of my career, I did not recommend them. I said, the studies show they didn't do anything but push food around, they're not effective in doing anything, don't use them. And then, a study came out of University of Southern California that said it kills and helps remove about 99.9% of the bacteria in the mouth. I'm like, as long as it's used properly. I'm like, so I read this, I'm a big, huge research person. I'm like one of those nerds that I gotta read all the research before I'm gonna start recommending it to anybody. So I read the studies and I said, well, you know what? I'm gonna do my own little mini study. So I had my patients at the time, I was still practicing clinically, and I saw patients that I thought would benefit from the water pick because they had bleeding gums, inflammation, and they didn't like to floss, and they didn't want to floss. So I recommended to get the water pick. And I said, look, I really want you to get it because in about 3 months, I want to check your gums again. So I had about 4 or 5 patients I did that with, not in 3 months, but within about 6 months, I did that. And sure enough, my own little unscientific study, I could see they had a reduction in inflammation, reduction in bleeding, reduction of plaque and tartar buildup. So I'm like, okay, it does work. Now, I don't care if a patient doesn't floss. If they're water picking, that's what I want them to do. Of course, I want them to floss, but I'm totally okay with the oral irrigator. There is a way to use an oral irrigator.
I first discovered water pick back in the late 1960s, and I've used one ever since. It's refreshing, invigorating, and easy to use. Since the 1960s, delivering the 1,200 pulses of water every minute, 99.9% of biofilm removal. Now is the time to discover the water pick for yourself. Keeping a few tips in mind, you will find it is easy and mess-free to clean your teeth and gums with the water pick. Here is an outside view demonstrating the angle of the tip to the teeth and gum tissue. A straight-on 90-degree angle is all that is required. Just remember you want the water to shoot along the gum line and straight through the spacing between the teeth. This demonstration shows an easy and mess-free technique for using the water pick water flosser. Fill the reservoir with warm water. Select the tip you want to use. For regular daily use, I use the jet tip. Select the power setting. Lean over the sink. With the tip placed in your mouth, turn the unit on. Keep your mouth slightly open to allow the water to run out. Slowly progress around to the front teeth and then the back teeth on the left side. Now inside to run the water jet along the gum line at the same angle. You can press the blue button with your thumb to pause the water flow while you switch from the top teeth to the bottom teeth. Another great smile kept healthy by water pick.
So, what do you use in a water pick? Water. Well, what else could you use in a water pick? Well, you can use water, but how about with ozone in it? Ozone, for those who have not taken, well, actually, Eric is next door talking about ozone. Ozone is a supercharged oxygen. It's O3 instead of O2. That extra molecule of oxygen, without going to a whole course, which you probably should hear it is, that ozone is antibacterial, kills bacteria, kills viruses, kills fungi, and kills parasites. So that ozone is extremely beneficial in helping reduce inflammation, bleeding, because it's killing off the bad bacteria. It's supercharged oxygen. So, okay, we have it in the dentist office. Well, what about at home? What can I do at home? There's these little ozone generators you can get. I'm sorry, Amazon is my favorite thing. You can buy anything on Amazon. This unit is probably about $65. Not super cheap, but certainly not $6,000 that a professional unit would be. And you can make your own ozonated water. Put that ozonated water in that water pick. There's patients who have gum inflammation and bleeding. Have them use the ozone water at home. You can use that. I'm telling you, it will help tremendously. Now, this is the essential oil video. Why am I pointing
Bacteria have the ability to change their genetic makeup over time for their own self-preservation. Bacteria have their own defensive mechanism. They produce something called a peptidoglycan layer. It's the equivalent of an M&M shell that's protecting the chocolate on the inside. Now, one of the other elements the bacteria are very, very good at making, and that is something called a biofilm. Biofilm is its own very goopy, slimy mess that it covers itself in. So what's now starting to happen is we are finding that once very useful antibacterial medications are no longer effective at all. What that means for us, we have to use stronger antibacterial medications. We have to use more potent antibacterial medications. That comes at a cost to our own bodies. Melaleuca has the ability to come in and start to modify that sludge and remove it so that the oregano can get to the bacteria. And in oregano, there's a product called carvacrol. Carvacrol will bind to that peptidoglycan, and it punctures a little hole in there. Once that hole opens, you start to get a passing of ions back and forth. What that does to the bacteria is it allows it to lyse. It means burst open. And we've now accomplished something very dramatic, and that is by doing nothing more than using 2 simple little plant-based essential oils, you have created a very effective antibacterial solution.
So in the water pick, you can use your plain, for, like reverse osmosis water, filtered water, and then in the plain reservoir, you take 2 drops of the melaleuca or tea tree and 2 drops of the oregano, and you use that, and that's going to help reduce the bacteria count. The only thing is, if you do that with the water pick, make sure whatever water you don't use, dump out, and you clean the reservoir, because the essential oil can degrade the plastic. So that's the only thing you have to be careful of. I've had patients come back, well, my reservoir got old. So you're supposed to clean it. You can't just leave it. So that's the only thing to be careful of. So now that we've gone through all the things that you should not have in your toothpaste and all the things that you should have, things like xylitol, things that have bacteria-killing properties like ozone and certain essential oils, herbal solutions, ways of cleaning teeth other than using toxic floss, using a water pick, using coconut oil pulling. Some patients, I would recommend oil pulling over using mouthwash, because everybody feels they need to use mouthwash. No, the oil pulling is going to help clean the mouth and get rid of that bacteria, reduce the bacteria count. You don't have to worry about having bad breath. Another thing that I didn't put in here that I think is critical is tongue scraping. Using a tongue scraper, you have to be careful how you start with them, because in Ayurveda you use a metal scraper. Sometimes that's a little too harsh for some patients, or some people, they start and they can actually irritate and damage the pull on the tongue. So I recommend starting over the softer plastic tongue scraper and build up. Sometimes you can use the back of a spoon, but because the tongue has like little finger-like projections, bacteria and food can stick in there. And even if you're flossing and brushing like a fiend, but you still have something's not right, it could be coming from your tongue. Never mind, we're not even going to talk about the systemic, and that's when you have to go see the next vet. She'll help you there. That being said, using the tongue scraper will help that bacterial load. So at this point, I kind of tried to cover as much as I could within the period of time, so I don't know if anybody has any questions I can answer. Yes?
I've got a toothpaste called Vitameter, which is advertised as a natural toothpaste. Do you have any opinion about that?
Yeah, that one I don't know. And actually, at this point, and I was just having this conversation with somebody yesterday, at one point, it was so hard to find a natural toothpaste. Now, it's becoming almost like the regular conventional toothpaste out. There's so many that it's hard to keep up. But again, as long as it has things that are not harmful, like the triclosan and the SLS, and if it doesn't have, any artificial dyes and stuff, and I'm sure that it's going to be beneficial to you, and you want to make sure that it has healing properties or bacterial properties like essential oils like peppermint and cinnamon and If it has aloe vera, it's even better because that's pH balancing. So it's more of, it's hard for me to tell about that specific one. It's more like what's not in it. You don't know the things that we talked about earlier. So I'm sure it's probably very helpful. It's better than that other stuff, that's for sure. But that name I don't know. Yeah.
I've heard people say that oil pulling should not be used if you have mercury fillings.
Thank you for bringing that up. You're absolutely right. There is two sides, but there's more saying that you shouldn't. You're absolutely right. Some say, well, it's helping pull toxins out of the body. So if you have mercury fillings, it's leaching, it's off-gassing, so you have toxins going on in there, so it's going to help eliminate that. And others are like, no, because the more you oil pull, you're going to be pulling more of the toxins out. So there's two factions. I'm in the faction of, yeah, you're probably better off not oil pulling if you have mercury fillings. And it's funny, one of the doctors here, she just went to Poland because there was a mercury meeting, and they didn't have anybody in the dental field. And she got there, they were like, why are you here? You're a dentist. You're not, a PhD in mercury research. Why are you here? She says, well, I'm talking about mercury amalgams. The mercury in your fillings. She goes, I don't have any mercury in my fillings. She goes, I have silver fillings. Okay, so you don't know what you don't know. Is PhD, brilliant minds, they don't know. So that being said, she was telling them how, leeches and all this. How did I go off on this tangent? Anyway, that being said, yes, I would agree, better off not using oil pulling during, and that's what I tell my patients, again. So thank you for bringing that up.